Irene Castillo didn't even have a day to grieve after her husband died of COVID-19. She was sick, too, coughing and struggling to breathe. He was barely gone when she started using his oxygen mask. The same day, on March 22, she was admitted to a hospital in Sao Paulo. The 71-year-old had followed doctors' instructions to the letter, dutifully taking her doses of hydroxychloroquine. She also took ivermectin and a battery of anti-inflammatories and vitamins in the so-called COVID kit that her health care company, Prevent Senior, mailed to her home. Still, her condition had deteriorated. At the hospital, Castillo received dialysis and was intubated. When physicians consulted Castillo's daughters about giving her flutamide, a drug typically used for prostate cancer, they declined, worried about possible side effects for their mother who recently had liver cancer. They later saw a nurse administering flutamide. She told them it had been prescribed despite their objection. Castillo died in late April, 33 days after her husband, and her daughters scattered her ashes upon his grave. You know that passionate couple. That was them, her daughter Katia Castillo told the Associated Press in a video call from northeastern city João Pessoa. That's what keeps me from staying silent. That's what makes me unafraid. It's a truth that I wish were a lie. It's a wound that will never scar.
Castillo's case is one of a series of examples that have led to explosive accusations against Prevent Senior, which operates 10 hospitals in Sao Paulo, that have scandalized Brazil since mid-September. Whistleblowing doctors, through their lawyer, testified at the Senate last week that Prevent Senior enlisted participants to test unproven drugs without proper consent and forced doctors to toe the line on prescribing unproven drugs touted by President Jair Bolsonaro as part of their COVID kit. Some senators have said it appears Prevent Senior falsified death certificates to omit COVID-19 as cause of death. Authorities are also investigating the complaints the company conducted research without proper permission. The case underscores the resilient rift in polarized Brazil over proper treatment of COVID-19 patients, with many in the nation, including the unvaccinated president, bucking global scientific recommendations. And there's concern that other providers likewise implemented dodgy policies. 2 weeks ago, Pedro Batista Jr., Prevent Senior's executive director, testified to senators that doctors were free to make their own prescriptions for treatment of COVID-19 and said patients had freely agreed to take their COVID kits. It didn't respond to questions about how many patients received the COVID kits. Brazil has a public health care system, though service is often subpar. Many middle-class Brazilians have private plans, but costs for the elderly are high. Prevent Senior seemed to help fill that gap. It was founded in 1997 and grew among those who couldn't afford premium care. Its monthly cost is about $300, half that of some competitors. The company has more than 500,000 clients, with an average age of 68. 3 doctors formerly employed by Prevent Senior, George Jopet, Alessandra Jopet and Walter Correa de Souza Neto, told television program Fantastico on October 3 that doctors received instructions from company officials to prescribe hydroxychloroquine. Until that interview, all had remained anonymous. Souza Neto repeated that assertion in Senate testimony on Thursday. Between the end of March and April, instituted a protocol to prescribe hydroxychloroquine for patients. There was no autonomy for the doctor, it was mandatory. The antimalarial has been given glowing endorsements by Bolsonaro and his allies, who are among few remaining global champions for the drug. While a few studies at the pandemic's onset suggested it might be promising, they were largely conducted in lab dishes, not people. Extensive worldwide research has long since found it to be ineffective and potentially dangerous for COVID-19. The doctors also said they were told to prescribe ivermectin, an anti-parasite drug whose effectiveness for COVID-19 remains unproven. The American Medical Association recommends against prescribing it outside of formal trials. Both drugs are part of what President Jair Bolsonaro and his allies refer to as early treatment for COVID-19. The president defended early treatment as recently as September 20 at the UN General Assembly. He and his lawmaker son had also cited the healing potential of proxalutamide, an anti-androgen similar to flutamide that is still undergoing trials as a potential COVID-19 medication. pressure to prescribe hydroxychloroquine and ivermectin is corroborated by internal Prevent Senior chat groups on WhatsApp obtained by the Associated Press, and which were previously shared with the Senate committee investigating the nation's COVID-19 response. They include messages sent by Benedito Jr. and another executive, 2 current clinic directors, 1 former clinic director, and an unnamed physician. Both drugs are also relatively inexpensive. One of the directors sent messages demanding their prescription while highlighting Prevent Senior's slipping finances. "We can't lose focus. We've started having bad revenues again," a director named Rodrigo Esper wrote to doctors in May 2020 while urging use of the drugs. "We still haven't hit the peak of the pandemic and we're losing revenue." Lawyer Bruno Morato, who represents 12 doctors currently or previously employed by Prevent Senior, told senators on September 28 that her clients were repeatedly told to choose between prescribing dubious drugs or losing their jobs. In PauloThe, Brazil, perspectives on COVID-19 have assumed ideological contours, particularly as Bolsonaro repeatedly downplayed the disease's severity and undermined governance and their measures to control its spread. Armchair epidemiologists have shown themselves willing to excoriate anyone who voices trust in the so-called global experts or expresses doubt about the effectiveness of the COVID kit prescribed by doctors at Prevent and elsewhere. Bolsonaro claims that the Senate committee is politically motivated and working unfairly to pin the pandemic's deaths on him. The press office of Brazil's presidency didn't respond to requests for comment for this story. On March 21 this year, a doctor sent a message saying an executive named Rafael had told her that prescription of the COVID kit was mandatory. "Rafael told me prescription of the COVID kit is obligatory, but I don't feel comfortable with that. I'd like to know how I should proceed," the doctor wrote to a recipient who was not identified. The message was one of those shared with Senate investigators. Some patients other than Castilho also were given flutamide, though with consent.
Thank you for watching. Please subscribe